Hi, I'm Belinda Hodder. I am the Clinical Director for Midwifery Services here at Willow Midwife Center for Birth and Wellness. My first part of my nursing career I spent in the British Army. I was a battlefield medicine nurse. All those years ago, I just knew I wanted to be around women, helping them make really good decisions and helping them get the care that they needed. So when I left the Army, I said to one of my friends, I really need to be in women's healthcare, that's what I need to do. And she said, you need to be a midwife. I was like, oh no. I really don't like babies. She said, it's nothing to do with the babies. She said, it's more to do with the long-term relationship that you have with a woman. You meet them for 10 months. You get to be with them through this transformational phase in their lives. And I went into midwifery training in the UK and loved it. It was exactly where I needed to be. During that time, I had my 3 sons. I worked in all community settings, in hospitals, free-to-standing birth centres, home birth. I did some work with the government, got some legislation passed, and was a board member on the nursing board. So had a lot of fun time, and came about that my husband decided to emigrate to America. So I thought, that'd be fine. What would be so different in America? So we transferred all our qualifications over. Unfortunately, they wouldn't let me be a midwife, but they said I could be a nurse. My husband was like terrified. He's like, you've been a midwife for 10 years, you don't even know what nursing is anymore. So he laughed about that. So I came over and practiced as an L&D nurse because I didn't think it'd be very much different. And that's where the story starts, really. The care in the hospitals were, at that time, which is 10 years ago, very outdated, very paternalistic, very medical model. Women and babies weren't getting evidence-based care, and I just thought, I have to go back to midwifery. So I went back to midwifery school. I did Frontier University and retrained as a midwife. I can tell you, babies still came out the same way, wherever you work. And then after that, decided to work in a hospital-based practice in the East Valley. That's where I met Diane. And we changed the face of hospital birth. We had a really low C-section rate, really low epidural rate. Women came to us for water labor. We brought lots of evidence-based care into the hospital setting. About 6 years into it, we realized that we'd gone as far as we could go with that, and women were still not getting evidence-based care, nor babies weren't, after they'd had their baby. Their babies were being treated in the NICU for things they really didn't need to. Women were being postpartum, not evidence-based care, not really good care, and these were the majority of low-risk women. So we wanted to provide a birth centre, a freestanding birth centre, staffed by board-certified nurse midwives, so that we could give this holistic, evidence-based care to mom and baby dyad, well, to the whole family, really. So that's the story.